Health officials need all those tools and all the equipment available. So how can the rest of us help with that? Dr. Janice Johnston with Redirect Health is joining us live via Skype to answer a couple questions. First, Dr. Johnston, you have a message for patients. What should they keep in mind right now?
Well, I think the primary thing that people need to keep in mind is if that they're feeling ill, they need to stay home. We really want anyone who's feeling ill to be evaluated as soon as possible so we can direct your care. We at Redirect Health have set up a coronavirus and flu hotline. It's at redirecthealth.com, and we're ready and on standby to give you some direction for that. If you do have some sort of elective type of thing, we would prefer that if you can postpone that so we can preserve supplies of gloves, of masks, of gowns, all that, those kinds of things that would be used in elective type of procedure that can be used to protect our healthcare workers against coronavirus so that we don't start to get sick.
Have you been able to send any of your patients to get a coronavirus test?
Yes, we have. We do have a limited supply, and we get it on a daily basis. So we actually have started to test for corona. We started testing last Wednesday. It's a nasal swab that goes into the nose. We've had some test results resulted through already. We don't have all of them. Thankfully, so far, we have not had any positive cases come through, but I am anticipating several positive ones to be popping into my inbox here shortly.
At one point, the president said, if you want a test, you can get a test. That was not true for a long time. Is it true now? If I wanted a test, if I had symptoms, could I get one?
Well, there's what's recommended, and then there's reality on the ground. And reality for us right now is that we do not have enough tests to test everyone who's calling in with symptoms. So we are focusing as doctors on people who have the primary symptoms of corona, that being fever, cough, and shortness of breath, and then also those who would have some additional comorbid type of conditions going on, and the elderly, of course. So we're focusing on them. We're hopeful that as the days go by, that we will see more and more tests come through that are able to us, so we can test more and more people. But right now, we just don't have enough. We're expecting a shipment tomorrow that should increase our capabilities to test patients at a greater volume, and so we're hopeful for that.
Can we talk about elective surgeries? I know some offices have asked patients to postpone elective surgeries. What is an elective surgery? Can you give me a list of them?
Sure. So things that would not be elective, you know, I fell down the stairs and I broke my ankle and I need surgery to repair that. Well, you can't really put that kind of thing off, right? I have a heart attack and I need an open heart surgery. You can't put that kind of thing off either. But say you're going to get your knee replaced, you know, that's more elective. That's not something that's urgent. And even though you might feel, you know, you have a lot of pain, you've most likely been living with that for a long, long time, and you can live a little longer with that just to make sure that there's enough supplies that are on hand.
And are you still seeing a lot of people come in with regular cases of the flu?
So it's interesting, as we are testing for corona, we're screening for the flu as well, too. And out of the handful that we did do today, yes, we have a positive flu test today. So I do want to remind people that the flu is still out there, and we have a test, an easy point-of-care test that can be done. We also have treatment that, if started right away, can start to make you feel better a lot quicker. And I do want to remind folks that there is a vaccine for the flu. Heaven forbid anybody got the flu and coronavirus at the same time. So at our facilities, I probably have about 800 flu vaccines still left in stock, and it is not too late to get one.
Still available. Dr. Janice Johnston with Redirect Health, thank you for joining us live today via Skype. We appreciate your time.
You're welcome.